Every day, all over the world, doctors are performing countless numbers of heart surgeries. But when you learn that you need to have heart surgery, countless surgeries become just one, yours. When preparing for your heart surgery, it's natural to feel nervous, even anxious.
I didn't have a whole lot of time to think because, it was just happening so quickly. I remember saying that I'm scared, and just I can't believe this is happening to me.
Now in my 30s, more responsibility to my family, my son. Not so much about myself. Well, myself, because I definitely have to get healthy for them.
You go in and say you're going to have a triple bypass, you're going to get heart surgery. That was like, whoa, what am I doing here?
This program will help relieve those fears by reviewing bypass and valve surgeries, what to expect before your surgery, and your first days of recovery. The heart is a muscle that pumps oxygen and nutrient-rich blood throughout the body. On the outside of the heart, large blood vessels called coronary arteries wrap around the surface and deliver oxygen and nutrients to the heart so it can do its job. On the inside, blood moves from chamber to chamber through valves. Each time your heart contracts, blood is pumped forward. When your heart relaxes, the valves prevent blood from flowing backward. Normally, blood flows easily throughout the heart and to the rest of the body. But over time, your heart can become damaged. A fatty substance called plaque can build up in the coronary arteries. Plaque causes the arteries to narrow, reducing or completely blocking the amount of blood that can get to the heart. When the heart doesn't get enough blood and oxygen, parts of it can become permanently damaged and even die. This can lead to chest pain called angina, heart attack, and stroke. And over time, the heart valves may weaken or become damaged, preventing them from opening and closing properly. This can cause blood to back up in the heart chambers. Depending on the specific damage to your heart, your cardiac care team will determine exactly what type of heart surgery you need. Coronary artery bypass surgery, or coronary artery bypass grafting, restores blood flow to the heart. During this surgery, a blood vessel from your leg, forearm, or chest is removed and used on the surface of your heart to create a new route for the blood to flow. It will bypass the clogged portion of your coronary artery and restore blood flow to your heart, allowing it to once again receive the oxygen and nutrients it needs to function. Heart valve surgery either repairs or replaces any damaged heart valves you may have. If you need a replacement valve, your cardiac care team will recommend either a mechanical valve or a tissue valve. Both valves work in a similar way and allow blood to flow properly through your heart. It's not uncommon to fix more than one heart problem during your surgery. For example, if you have damage to both your coronary arteries and your heart valves, your cardiac care team may decide to do a combination of both coronary artery bypass surgery and heart valve surgery to repair the damage. And if you have atrial fibrillation, they may decide to surgically treat this heart problem at the same time.
Because I had this atrial fibrillation for some years, the doctor suggested to me that since he was going to be in there working on my heart, that he would try this procedure to try to get me out of atrial fibrillation.
Depending on a number of factors, including your overall health, age, and type of repair your heart needs, your cardiac care team may talk to you about minimally invasive surgery.
It looks like you'd be a great candidate for the minimally invasive approach, where instead of using...
This method of surgery lasts about the same amount of time as traditional heart surgery, but your cardiac care team will use a number of smaller incisions to get to your heart. Sometimes special robotic tools are used to help your cardiac care team perform more detailed actions. No matter what type of heart surgery you are about to have, make sure you understand what is going to happen and ask your care team any questions you may have now, before your surgery. Although you may feel nervous in the time leading up to your heart surgery, there are some basic instructions you must follow in order to be ready. If you smoke, you are at an increased risk for complications during surgery, so quit as soon as you can. Talk to your cardiac care team about how to quit smoking. Review all of the medications you take, including vitamins and supplements, with your cardiac care team. You may need to stop taking some medications prior to your surgery. Pack a small bag to take with you to the hospital. Your healthcare team will suggest specific items to include that can make your stay more comfortable. Leave your valuables at home. Before coming to the hospital, you may be asked to shower and shampoo thoroughly with a special soap. The night before your surgery, don't eat or drink anything after midnight. If you have been told you can take some of your medications the morning of your surgery, try to take them without water or with as little water as possible.
Take them from your wife.
You'll change into a hospital gown when you arrive at the hospital. Remove any personal items like your glasses, contact lenses, or dentures, and give them to your family member for safekeeping. At this point, a member of your cardiac care team will prepare your surgical site. As with any surgery, there are risks. Make sure you understand them. If you have any concerns, ask. Your cardiac care team wants you to feel comfortable in their care. If you haven't already done so, tell your care team about any allergies to food, medications, test dyes, or latex you may have, as well as any vision or hearing problems. Once you are comfortable, you will be asked to sign a consent form and then taken to the operating room.
Very good. Thank you very much. Now are you?
I was extremely nervous, and it's very upsetting not knowing what's going to happen or how it's going to happen. Truthfully, the nurses, the doctors, everyone I met in the pre-op room, even heading to the operating room, they were extremely supportive. They were pleasant. They were very upbeat about the whole thing, and to take the ease off, or to ease your concerns and stuff. They were excellent about doing that stuff.
In the operating room, you will be given medication to help you sleep called anesthesia. Little discs called electrodes are attached to monitor you. And an IV provides you with medication, anesthesia, and fluids. Once you are asleep, a catheter is used to collect urine, and a breathing tube helps you breathe. Depending on the type of heart surgery you are having and your condition, a heart-lung machine may be used. Heart surgeries usually last from 3 to 6 hours, depending on the damage your cardiac care team needs to repair. While you are in surgery, your family will move to a waiting room to be kept up to date on your progress. To avoid any confusion, choose just one family member to get updates from the hospital staff.
Everything is going fine. Surgery is going smoothly.
Good.
Okay?
Good. Thank you very much.
Once your surgery is finished, your cardiac care team will let your family know how you are doing, and you will move to intensive care. When you first wake up, you may feel groggy and confused. Some patients say they feel thirsty and cold. The sound of the machines beeping and the feel of tubes and wires connected to you can make you feel anxious. it is important to stay calm and relaxed. These help monitor how you are doing. If you can't talk because your breathing tube is still in, your cardiac care team will ask you yes or no questions. Answer by nodding your head. And don't worry, your breathing tube will be removed when you are wide awake and can cough and breathe on your own.
The biggest thing about the ICU part was the ventilator, just being, with them removing it and just feeling like, okay, this is one step to recovery.
It's also normal to feel some level of pain and discomfort after surgery. Tell your cardiac care team when you are in pain and how much pain you are feeling. They can help you manage your pain.
When you're coughing and breathing deep, what would you rate your pain? 0 being none, 10 being the worst you've ever had.
Normally it's like 3 or 4, but when I cough or breathe deep, it's definitely like 6, maybe 7.
Okay.
It's much worse.
Managing your pain properly will allow you to feel comfortable enough to do the things you need to do in order to recover. Some pain will go away with time and as you begin to move. Other pain can be relieved with medication given orally or through your IV. Intensive care generally lasts 1 to 2 days. During this time, nurses, doctors, and other hospital staff closely monitor your progress. They can answer any questions that you or your family members may have. As you get stronger, your family can visit. You need time to rest, so these visits may be short and limited to only a small number of family members. When your cardiac care team feels you are ready, with help, you will start to move and do other activities to help your recovery. With help, move from your bed to a chair. You are at an increased risk of falling, so for your safety, always follow your care team's direction when moving. Keep your legs elevated when sitting in a chair.
Hi there, Mr. Jones. I'm going to do some breathing exercises with you.
To strengthen your lungs and prevent lung infections, you will do breathing exercises called Invasive Spirometry and controlled coughing. Invasive Spirometry helps you breathe easier by helping you breathe deeper. Controlled coughing opens up the tiny air sacs in your lungs and helps get rid of any extra mucus. A pillow or teddy bear to hug while you do your coughing exercises can relieve some of the discomfort you may feel because of your incision. When your cardiac care team feels you are ready, you will progress from intensive care to a step-down level of care to continue your recovery.
When you get to graduate to the step-down unit, you feel pretty good about that because you know the next step is home.
In step-down care or progressive care, you can start to become more active. Get out of bed and move around. Sit in a chair instead of your bed to eat your meals, keeping your legs elevated. With help, walk the hallways 2 or 3 times a day. Talk with your healthcare team before trying this on your own. Because of your increased fall risk, there may be tools you can use to help you balance while you walk.
You okay?
Going down to a step-down unit, there are nurses there, they always come in and try to push you a little bit. Like, you got to try to move. And you don't think about this thing because the only thing you think about the pain. But it actually works because the more you move, the better you get.
As you continue to recover, the number of visitors allowed may still be limited depending on your progress. Make sure everyone who visits washes their hands before coming into your room to reduce the chance of infection. And if a family member is sick, it is safer if they just stay home. There is no set time for discharge from the hospital. Most people having heart surgery stay 4 to 5 days, but your length of stay is specific to your needs.
Well, of course you're nervous about having surgery because it's the unknown. What's going to happen?
I'm much, much better, and I'm pretty much recovered. The recovery is, I wouldn't say fast, but, you know, it's in a good pace.
truthfully, overall, this has not been a terrible experience. I'm very glad that I had it done, and I'm very glad I found out I needed this done before it was too late.
Right now, you are preparing to have heart surgery, and this is a lot to take in. Follow your cardiac care team's instructions and ask them any questions you have. Take an active role in your own preparation and recovery. And in a couple of weeks, you can look back and add your heart surgery to the countless other success stories happening every day.